Welcome to today's special event hosted by eLotus and sponsored by Evergreen Herbs. I'm Donna Chow, your host. As your leading source for quality CEU content with a legacy of over 2 decades, we offer educational courses to help you elevate your knowledge and expand your skill set. With over 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. So today's webinar, we have Analyzing and Decoding Laboratory Results in Relation to TCM Diagnosis, Part 1 with Dr. Jimmy Chang. Class is from 2 to 5 p.m. Pacific Time. To ensure an interactive session, please set your chat preference to everyone, and that way everyone who is attending today can be part of the conversation. And please do use the Q&A box for instructor questions only. Dr. Jimmy Chang is a renowned expert with over 40 years of clinical experience treating more than 500,000 patients. He will delve into pulse diagnosis and herbal prescriptions, focusing on his unique herbal combinations. He has been exclusively supplied by Evergreen Herbs for an impressive 25 years, making them the perfect partner for his clinical practice and research. We are honored to have Evergreen Herbs as our sponsor for this webinar, given their commitment to quality and service. Dr. Chang, he has previously taught several courses with us, which are now available as distant learning CEU videos. Elevate your pulse diagnosis and herbal skills with our go-to expert. And consider the Gold Pass membership for unlimited access to his foundational pulse and herb courses prior to 2020. The Gold Pass with an exclusive herb voucher from our sponsor, Evergreen Herbs, allows you to experience these herbs firsthand. It is a fantastic opportunity for serious herbalists. Okay, so let's go ahead and begin today's class with a brief overview of Dr. Chang's unique herbal approach. If you are a seasoned student, please go ahead and take a moment, grab a coffee, grab a tea, and take a 5-minute break because this part is going to be a refresher for you. Or you can just sit and listen along too. Okay, so let's begin. Dr. Chang's herbal style, it is a little different from traditional methods as he exclusively uses extract powders from Evergreen Herbs. And Evergreen Herbs offers around 300 single herbs and 100 formulas. And Dr. Chang's pharmacy, he has 150 single herbs and formulas combined. You can find more details about Dr. Chang's pharmacy in his YouTube link, which is linked into your lecture notes. And then for those of you who are interested in starting a similar pharmacy, Evergreen Herbs is offering a 15% webinar discount on the essentials. And you can find the link in the chat room, or you can also refer to them in the lecture notes for more detail. So formula evolution is the core of Dr. Chang's practice. He creates his own formulations with the names to reflect the purpose. And he adapts them over time based on patient experience, marking them with 2.0 for updated versions. And so part of the idea of formula evolution is Fang, which is formula plus formula, which Dr. Chang combines different single herbs or formulas to enhance their effects. Now, Evergreen's extract formulas, they are decocted and extracted together rather than just combining individual single herbs. So for a more detailed explanation of Fang, Dr. John Chen has a video explaining the concept in more detail on YouTube, so you can check YouTube and your notes for the link as well. As for dosaging, Dr. Chang's herbal prescriptions are usually provided in 100-gram bottles, and his typical recommendation is 3 spoons 2 to 3 times per day. Now, how do you read Dr. Chang's prescription? Well, the number following the herbs signifies the percentage. For example, in Sleep Combo 2.0, Suan Cao Ren Tang has a 40% after it, and then it's written Yi Jiao Teng, He Huan Pi, Zi Tong Yan, and those are all 20%. And then he writes 20%. So that means everything before that is all at 20%. Okay, let's test your knowledge. So I gave you the ingredients. What do you think what's the percentage of Zi Tong Yan in a 100-gram bottle? Go ahead and type your answers into the chat room. Okay, and if you got 20 grams, you are correct. If you wrote anything else, you need this class. All right, so for those inclined to mix their own herbs, it's definitely an option. While some formulas like circulation sanjiao and astringent complex, these are already pre-mixed in Evergreen's collection formula line. But many of the new ones are not yet because Dr. Chang is still customizing them. So feel free to create your own blends or use Dr. Chang's formulas as a base. All right, so this concludes my short introduction. Now for the main show, let's go ahead and welcome Dr. Chang to start the class. Thank you guys for attending today's webinar. It was great having you, and a huge thank you, of course, to Dr. Jimmy Chang for your generosity in sharing your knowledge today. If you enjoyed today's class, please consider sharing your thoughts with your colleagues on social media or in person, however you like, so that we can meet them at the next webinar too. Okay, so very important, everyone, to receive your CEU credit for today's webinar, you will need to take a quiz, and then we will email you when that quiz is ready. You should get that email within 24 hours from now. And other than that, we look forward to seeing you guys at our next webinar on March 9, 2024, exploring the interplay of sleep, respiration, and circulation in TCM with Dr. David Soul. See you guys then. Bye.
Still low. Better? How's this? Okay. Low audio. Can you turn it up a little bit more? Thanks. Okay, how about now? I think it's better, right? Okay. So, good afternoon, everyone. Today is going to be a fabulous class. I hope you're all doing well and your family's doing well. Welcome to today's class. Today's class is something that I have been wondering for the longest time, and finally, one day discussing with Dr. Chang to see if he would help us decode this lab value results. So I'm excited to share with you what he has to say today. And if you have any questions, please feel free to type it into the Q&A. There's a little Q&A box, and I feel like only senior practitioner like him with over 40 years of experience can hold this type of class and, have enough knowledge for us. Now, can you type into the chat room for me so that Dr. Chang can have a better idea how many years you have been practicing? So can you type in how many years you've been practicing? And also, if you're new to practicing, just type in new. So 张医师10几年的，你看这些都是20、25年、15年、16年，大家都很久了。Very good. Everybody's been around for a while. Okay, so I see some of your setting in the chat says to host and panelist. Can you change it to everyone so we can all see your comments, please? Okay, next, what he would like to know is how many years have you studied Dr. Chang's style of pulse diagnosis and herbal prescription? Can you put in how many years you've studied with Dr. Chang? 0 year, new, 0. Uh-oh. 0, new. Uh-oh. Wow, you're in for a treat today. Okay, we have a lot of new people, Dr. Chang. So we have to go a little slower today and explain some things. I'll help explain, because to him, when you're very advanced, sometimes they don't understand what we're asking, what we don't understand, because they think everything is very obvious. But it's not. So I'll do the best I can. I'll also leave you my email later at the end of the day. Please remind me if I forget. So you can email me if you have any questions. Oh, actually, our moderator can help. My email is tina.chen@evherbs.com. So later, if you have any questions, you can email me. Now, today's class actually is only part 1. There are 2 parts because there are a lot to talk about. So you guys are lucky today because as he was doing the lecture notes, he wrote a bunch of things And I told him, we're not going to finish today. So he said, oh, okay, then this can just be bonus material for next class. So wherever we finish today, everything else is for the next class, and it will be bonus for you to kind of take a look to see, what his interpretation of some of these lab results are and what it means. Okay, so let's dive right in, and then welcome Dr. Chang to today's class. Clap, clap, clap.
Do I have to open the unmute? With this, huh? Hi guys, this is me again, Dr. Jimmy Chen. I've been practicing over 45 years, going to be 50. Well, anyway, today is a new class. We've never done this before for the past almost 30 years in the United States with Tina. And today we're going to talk about the what? Lab report and related to Chinese medicine. And not only that, for you newcomers, we'll be talking about how to build up your career in the future. Being an acupuncturist or doctor of Chinese medicine is the lifetime job, and you can practice as long as you can live. So you need little help and little weapon to do that. And I'll be telling you how. It will be very useful for you guys or old birds or new birds. Okay, today, we got a lot of things in this content of this PowerPoint. I'm not sure I can finish them all by today, but the next seminar next month will be the part 2. It's even more good things coming up. Okay, next. Everything is based on my 45 years of clinical experience. I'll do all the things I'm teaching you, I'm sharing with you, is everything that I do every day. I just saw about 30 people this morning. I barely could make for this class. And even people ask me to stay. Some people from New York, please, Dr. Chen, can you see me now? I said, I can't. I go to the class. Oh, what? Okay, let's start with the introduction. One day in your clinic, a patient hand over a bunch of papers, something like this. I just got one this morning. Oh, hi, Doc, this is my test report. Would you care to take a look at it? He said, oh, what? I don't know that. I don't know how to read that. That's very embarrassing, isn't it? We are doctor of Chinese medicine, we're acupuncturists, but still, this is the modern world. At least we should know a little bit about something about the test report, okay? You cannot say just, sorry, I cannot read that. That's bad. Okay, but some of them okay. 这个是什么? Turn up variable. Okay, this is a sample test, 那个 blood test report. Calcium is normal. Can I use this one? Okay, glucose 94, not bad. Most of the time they have sugar problem associated with kidney problem. How do you know take the pulse of a glucose? I mean, the diabetic people is the right one. It's deep and forceful. Usually that's calcium, the glucose, the sugar problem. Also, you can read the palm. I'll teach you later at the end of today's class how to read the palm, not palm reading, not future, not a fortune teller, but how do we read the palm and to find out what's wrong with the body, including the kidney and the breast and the sugar condition. Most of the time, you can tell if the lady's breast, something in the breast, that would be very impressive. And okay, but for this person, these 3 numbers are too high. First is urea nitrogen. Usually it's called BUN. The blood urea nitrogen is the 33. It's a little higher than normal. Usually they call this number the kidney failure index. Actually, it's not. It's not correct. Then the worst word is this, the creatinine. This number is the most critical and most difficult number to change. Now, do you remember my previous class, the previous seminar with the kidney function, something, you remember, Tina, about the kidney? nephrotic syndrome stuff. I work with those doctors in the general military hospital. Once in the meeting, a doctor said, if, not to me, I was just a small doctor there, nobody cares about me. But he was talking to most of the people. If you can change the lower the creatinine number, then you can give a national 论文怎么说 thesis you can publish in the national the worldwide medical journal that you can do that. I didn't know anything then, but now I can. It's no big deal. I can lower that by Chinese medicine. And because why this creatinine is the most critical number, not only because it's very difficult to lower it, but when we do the calculation of the kidney function, that's the only factor that involved in that formula. I will talk to you later. Not the urine nitrogen. The EGFR is the filtration rate of your kidney. It's just like the filter in the water filter in the house, in the kitchen. That the filter is blocked, and the function is low, 30, supposed to over 90. It's not easy. Not everybody is good in that. And the albumin. Oh, this is the most important number here. Albumin is the blood protein in the blood. It's used not only for measuring the kidney function, but also for measuring the cirrhosis, liver cirrhosis. Most of people, I get all my information and experience when I was in Taiwan. A lot of people reading this test report, they say, hey, your number is good, but the albumin is low. No matter how good the patient looks, the liver function is still not coming back. So albumin is a very important number for measuring not only kidney functions, but also liver function. This guy is not bad. And about the nephrotic syndrome we were talking about, their albumin is about 1.5 or something, in a very low level. So their blood becomes so thin and the water filtration out, so they have a very severe edema, not only on the leg, but also on the scalp. And also their testicles are swollen big like a balloon. It's terrible. So albumin is a very, very important index for measuring kidney function and liver function. And sodium, potassium is not too important. Potassium is important for heart problem. It might be high, it might be low, and well, you will see a glucose. Remember my glucose? For measuring the heart problem, ischemia, the potassium usually not right. And the carbon dioxide, ooh, this is interesting. When the carbon dioxide, the number is changed, we'll explain to you later. It's not good. And phosphorus is associated with kidney function. And when the kidney is damaged, phosphorus will be up and down in a very strange way. So you have to stay away from food that contains too much or not enough phosphorus. You can check the internet. And most of us, this one is interesting. Uric acid. So what the uric acid got to do here? Sometimes when your function, the kidney function is low, the uric acid will rise. Or just simply gout. The uric acid could go sky high over 12, 10 or something like that. Then definitely we'll have joint pain and swelling ankles or whatever. And this is HbA1c. A1C is measuring the last 2 months, your sugar level for the past 2 months. Sometimes A1C can be high, but your daily sugar level is low. Or can be A1C is low, but your daily sugar can be high. So A1C is just a reference number, not so important. But for diabetes, sometimes you'll be over 6.4. That's not good. Stomach fire indicates the sugar problem. Ooh. I was so busy this morning. Any questions? So, nope. Okay. Oh, this is the formula for calculating kidney function is 140 minus the age times body weight in kilogram and divided by 72 times creatinine number. A guy, somebody questioned about this formula. Say, what's the body weight got to do here? So big, fat, chubby people or skinny people will affect their kidney functions? Yes, it does. And I did not. It's not. It wasn't me who invented the formula. It's invented by a name I cannot even pronounce. Maybe it's a German guy or something for a long time. So 140 is a constant. 72 is also a constant. So only variable here is the creatinine. So not BUN. So creatinine number is we use to calculate the clearance of the kidney function, like how many percentage. If it's over 15%, then it's fine, 20% good. But if it's under 10, it's pre-uremia. If under, it's about 5 or 6, maybe it's too late to turn back now. So be careful with this. Body weight might affect something, but only changeable factor is the creatinine. So make sure if you ask somebody to do a blood test for their kidney function, which you suspect that something might be wrong, then you must have this creatinine number included.
Dr. Chang, in the previous slide, can you go back to the previous slide?
Sure.
Doesn't the lab result give you like the, okay, do you see in the middle where it says chronic kidney disease stages? Yes. So, right, doesn't it already give you that here? You know, we don't need to calculate that number that we're using the formula, right?
Numbers calculated in the lab. We cannot calculate it.
You mean this one that is showing in the?
Yeah, it's in the lab blood work.
Right, I know. But what I mean is, it'll already tell you like what stage kidney disease there are. In 1, 2, 3, 4, 5. 5 is no good, right?
Yeah.
So, why do we need to still do that formula that you just taught us? What is the difference between that and this?
They are related. This we cannot calculate, but when the patient is sitting in front of you with a very strange low creatinine number, then you can calculate, hey, your kidney function only 20%. It's not too bad. Oh, you're only 6%. Sorry, I might not be able to help you or something like that.
So in your experience, when we're using herbs for kidney function that are low, in your experience, okay, at what percentage kidney function is it reversible where we give herbs and they can recover?
Between 5 and 10.
5 to 10% kidney function still okay for herbs?
Yeah.
Oh, that's very good.
Something around 10, 8 or something. 5 is a little bit too difficult. Sometimes it's too late.
And in your experience, how many months does it take usually for them to come back another 5, 10% function?
Oh, several months.
Several months?
That's one way. There's another way of finding out the kidney problem. Take the blood pressure. I always advise you to take your patient's blood pressure entering before sitting in front of you. Take the blood pressure, and the blood pressure is so high, around 180 or something, and the patient is anemic. Then that equal to kidney failure. How do you know the guys or the lady is anemic? By looking at the neck one, heart 7 area. We've been teaching that for a long, long time, huh?